Hi, I'm Cary Adams, the CEO of the UICC, and it's my absolute pleasure to introduce Charles Goddard today. Charles is a conversation with me talking about his role at the Economist Intelligence Unit, what he does, and maybe we'll touch on some of the priorities of that organization and the war on cancer, which we are a great supporter of. So Charles, welcome. Perhaps you could introduce yourself. Tell us what you do at the Economist Intelligence Unit.
Gary, thank you very much, and thank you very much for inviting me to speak today. And I'm actually editorial director at the Economist Group, which is a slightly different role. I used to be part of the EIU, and now I have a role which is largely defined by trying to put together large programs for the group that help to leverage the brand of the group to affect, affect progress in certain public policy issues. And it's always been said by the former editor-in-chief of The Economist that we use the tools of economics to bring to life and to assess and evaluate and hopefully make progress around pressing public policy issues. And that's effectively what we're trying to do.
Which is why we know each other, because as we know, cancer and more broadly the NCDs are a pressing global health issue. And our relationship goes back quite a few years now, because we got involved with the war on cancer. You've been a guest interviewer at the World Cancer Leaders Summit, and I know that your involvement with us has certainly raised the bar about how we position not cancer just as a health issue, but as an economic issue, as something which is more important than just being within the health department in most governments. I mean, is that something have you seen a change in that over the last decade or so?
Well, firstly, let me say it's been an absolute pleasure and an absolute privilege working with UICC, and I think the relationship between the Economist Group and EIU and the UICC has been absolutely fantastic. In particular, I can, the highlights of that for me, when we've done joint training sessions, for example, with people from around Asia who've come from governments to learn about national cancer control programs, which I think has been absolutely incredible. And so that relationship is extraordinarily important to us. I think, yes, we have seen, I've certainly seen in the last 10 years since we started the War on Cancer series, a major set of steps forward, particularly here where a lot of that focus has been in Asia, around particularly the way in which governments conceive and perceive of the importance of cancer. I think you're absolutely right in saying that the way to a government's heart or the way to a government's wallet is through the economics, and ultimately, I think that case has not been made as well as it could be. And I think one of the reasons why we're still a long way behind, not only sort of low average health spending in general, but spending on cancer in particular in many countries in this region and indeed in Africa and elsewhere. Looking at LMICs particularly, that we really need to make a better case for the economics of cancer, and not just how it impacts people individually and their own wallets, but out-of-pocket expenditure being a really big issue, but how it affects economies and productivity in those economies, and how you get finance ministries in particular. And Cary, you and I have spoken about this before. Finance ministries are always so difficult to get to the table. And once we can get them to the table, we actually have a better and more defined conversation with them, I think.
Charles, I mean, do you think there's a bit of a silver lining, though, coming out of COVID? As horrible as it's been and the devastation that's caused, it's actually, I mean, certainly during my lifetime, it feels like it's the first time a health issue has been at the head of government. It's involved all departments of government. It's involved a rethink about prevention. It's made hopefully governments reflect on that investing in health and health protection over time is a good investment. Do you feel that there's a little bit of a silver lining there, that the governments now are more conscious of the value of investing in health, or is it going to be finished and then we move back to the old style where cancer is parked in the health department and no one actually thinks about the health system improvements? I mean, I'm hopeful there's a bit of a silver lining. What do you think?
I'm hopeful, but there's always a pessimist lurking in me. And I think you're right that certainly health has now come up the agenda for governments. And my sense, though, is that COVID. First of all, I mean, if we're talking about cancer, COVID has, I think, put cancer back several years in many countries, and particularly in LMICs, but not just in LMICs. I mean, in Britain, for example, I think we've got a backlog of cases, a backlog of diagnosis, and certainly of treatment that is going to take a long time to wind itself through. And that's even more, I think, pronounced in countries like India, in countries like Indonesia and Philippines, where we've been working. And thinking about then the challenge that these countries face in addressing the sort of their national cancer control programs and how they reframe those in the next 5 to 10 years to catch up, in a sense, on all the lost ground that's there, how they address the financing around this and how they allocate resources in order to be able to address what has effectively been a sort of a setting back of cancer control, I think is going to be really important. And my worry is that that is not going to be front of mind as we come out of the pandemic. I think the other thing that I would mention too is that we really have to think about the next pandemic, and having effectively not had the capabilities to manage cancer and cancer control during this pandemic, what are we going to be doing to actually set in place the right plans for the next pandemic? Because if we don't do that, I think we could be caught with our pants down again.
Yeah, Charles, you're absolutely right. I mean, I've read the output from Macmillan in the UK and Cancer Research UK talking about tens of thousands of cases that have not been picked up because screenings have been cancelled or people have been reticent about going into the health system. I've sort of called it the great cancer catch-up. We've got thousands of individuals who are moving progressively from stage 1 to stage 2 to stage 3. And as you'll be aware, cancer treatment in stage 3 and 4 is incredibly complicated and expensive, and far beyond the reach of many countries outside of Europe and North America, et cetera, et cetera. I think one of the things that's been interesting for me as an observer through this crisis is the power of the media. Now, you are obviously part of the media and getting information out to the world, the general population, general public about what's going on. How do you think it's gone? Because there's a lot of misleading information out there now on COVID, but do you think that properly represents generally how health is presented by the media, that information hasn't been checked, it's not based on science, it's not based on evidence? I mean, what's the position of The Economist on this?
Well, I'd like to say that there is a default to quality media in this process, and I hope and I believe The Economist is exactly that. And I think our coverage, and indeed the coverage of a number of our peers, has been very strong and very good throughout the COVID process. But of course, not everybody reads us, and people take a lot more recognize a lot more what's been said on social media, and a lot of that has been very problematic. Insofar as there's been a flight from that to quality media, I don't think necessarily there has been, given the sort of the large level of misinformation that's out there and the misgivings that are sitting around that. Can the media? I think one of the challenges too is we've talked a lot about COVID in the media, and of course we continue to talk a lot about COVID, but we don't talk a lot about the other health implications that have been raised by COVID, and cancer, of course, as we've just spoken about, is one of those, but not just the only one. And the way in which we're able to have and deliver health systems effectively, and the fragility of many health systems, means that COVID is exposing real problems. And I don't think the media has been very good at looking at that set of questions. And then beyond that, the set of questions about how do we manage both pandemics and other particularly chronic diseases in an effective and just and equitable way. Is the life of somebody who has COVID more valuable than the life of somebody who has cancer, for example? Those questions are not being raised in a way which I think is helpful by the media. And I think there's a lot more that the media could be doing to explore the general health conditions that we sit under, the public health conditions that we sit under, in respect and relation to COVID, rather than just COVID itself. And I think that's a big missing component.
I think obviously COVID dominates the coverage, and it dominates all of our lives anyway. I mean, I've been double jabbed. We're worried in Switzerland whether the vaccination rates will get to a point where we get herd immunity. I mean, it dominates your family discussions. Every meeting I have, we start off with COVID. Now, how's it for you? It used to be the weather, Charles. Do you remember that? We used to talk about the weather. What's the weather like in Hong Kong today, by the way, Charles? You know, I mean, that would be the, but now it's like, what's the COVID situation in Hong Kong? So it is dominating everything. And I think you're right. You know, perhaps UICC and other great organizations like yourself, we need to focus over the next couple of years about transferring the conversation over to what are the underlying learning points that we've had through this horrible pandemic. So as you say, we don't have the same situation where we have a backlog of cancer cases again. I hear some stories about surgery being delayed for 2 years, 3 years, and this is just clearly not acceptable. And I think we've got to become more aggressive in our advocacy for change, and for governments to recognize that they have to deal with the here and now, and they have to deal with the future as well. We learn through that. What great learnings have you seen, though, in terms of, we always see that innovation emerges out of a crisis. And I've been really inspired by many of the stories of UIC members who've adopted apps to communicate with cancer patients, you know, who've changed the model of interaction between the oncologist and the patient, et cetera, et cetera. I mean, there has been a lot of innovation coming through, but I guess the question is that sustainable? I mean, have you seen anything that you thought, well, that's really going to change the way that we deliver health to patients in the future, or treatment to patients in the future?
I think, I mean, you mentioned a couple of them, the digitization of the relationship between the patient and the health provider. I think that's really been an important change, and I think that's in many ways here to stay. I hope it is, at least anyway, because I think it improves efficiency, and it certainly improves access to some degree, at least. I think the decentralization to some degree, well, in those places where it has been possible to do this, and where there has been sufficient forward planning and there's been sufficient perhaps space from COVID. I mean, Australia, I think, is a very good example of this, where, you know, COVID perhaps didn't take hold in the same way that it did, say, for example, in the US and the UK, and there has been time for them to adjust and think about how to manage their systems, the decentralization of cancer care, particularly of some treatments, to sort of regional or local centers and health centers. I think some of those kinds of things are important. We could hope, as you earlier suggested, that there is an acceleration of policy around some of these things, and I don't know whether there will. I'm sure for some of those positive changes from COVID. And some of the others that you mentioned, I mean, some of the technology innovations that have been there, part of its digitization, but I hope that also the science innovations that have come to COVID and have led us into some extraordinary discoveries, both in diagnostics as well as in putting together, you know, virus technologies, is going to then transfer itself to some degree into the rest of the health space and into cancer too.
No, I hope so too. In fact, we have the World Cancer Leaders Summit coming up in Boston and around the world online, which is another transformation of our world. It's all going to be online as well. There's a session there where we're trying to get a speaker to talk about the learning points from the development of the vaccine for COVID, and how could that be transferred into learning for developing chemotherapy in the future. And that, I think that could be quite an interesting session at the summit. Charles, what's on your agenda at the moment? What's your priority work at the moment? What sort of things are you involved with?
Well, oddly, I'm going to say not cancer, but it's actually looking at, good Lord.
Good Lord, we'll have to stop this interview straight away.
Although, as you know, Cary, we have just done a program with you on with UICC on financing cervical cancer elimination, in particular looking at the funding for secondary prevention in low income settings, which was a fantastic project. And you know, that long may that continue. But my own focus at the moment is a number of different things. One of them is chemical pollution in the ocean, which is a big project that we're just about to undertake, a 3-year program looking at the extent of chemical pollution and its impact on ocean ecosystems as well as on human health, on both those areas. And another one that I'd dearly love to get off the ground, if I could ever find the organizations that might fund it, and that's around antimicrobial resistance, which are closely tied to the pandemic, of course, in so many ways. But has always been the sort of forgotten pandemic, if you want to put it that way, and the one that really does, in my view, need to be raised up the global public health agenda, and indeed has enormous implications as well for cancer and cancer control.
Well, you're speaking our language, because we actually are involved in the AMR challenge, because our board made a decision last year that we need to sensitize the cancer community to this growing long-term issue, because at some point in the future, if we don't resolve it, people will go in for cancer surgery and they will survive the cancer surgery, but they will not survive the infection, which is likely not to be treatable. So we're working on that. So there's definitely an opportunity for us to discuss how we can take that forward.
And I'd love to do that. I think it's really one of the pressing issues of the time, but there are so many, aren't there?
Well, it's good to talk to someone who's also looking at the longer term, because normally we're just talking about COVID tomorrow, next week, and the month after, and can I travel to the UK to see my family? So all those changes that are occurring week by week. But Charles, thank you very much for your time. Really appreciate it. As ever, it's great to talk to you, and thank you very much for your partnership with the UICC, and I'll hopefully see you face-to-face in Boston, maybe at the World Cancer Leaders Summit. Let's cross our fingers.
Cary, thank you very much. And as I said earlier, thank you also for this very long and wonderful relationship that we have. Thank you.
Have a great day.